Dr. Jeremiah Eisenschenk, presenting From the Ground Up, an invitation for self-care for physicians and healthcare professionals. This is both a reflection and a call to action. The views and opinions here expressed are those of my own. The story starts with the deep roots I have at St. John's University. I took my first steps there as a child, went to prep school and university there, and later married my wife, Ashley, in the Abbey Church. My understanding of the biopsychosocial and spiritual aspects of the human condition grew from these formative years at St. John's and inspired me to become the physician and leader I am today. I'm grateful to work for a healthcare organization with shared values, roots, and perspectives, those of respect, justice, joy, and stewardship, which are fundamental to the care of oneself and to others. My family and I often return to St. John's in the fall to visit my parents, who live on a ranch nearby. A visit a few falls ago yielded an epic St. John's victory with a phenomenal goal line stand amongst thousands of Johnny faithful. Following the game, I sauntered around campus. I visited Stella Maris Chapel across beautiful Lake Segatagan. After this, I arrived at the gravesite of my maternal grandmother and former nurse, Nancy Moran. I wouldn't be the person, physician, the husband, the father, the leader I am today without her guidance and inspiration. She remains a model of what it means to be a lifelong learner, a steward of the earth, and a lover of humanity. Exploring the area a bit further, I wandered down the hill towards the lake, where I came upon the gravesite of Jacob Wetterling. Many of you may know Jacob's tragic story. He was abducted in October of 1989 at the age of 11 years old. I grew up in the small town of St. Joseph, just down the road from Jacob and his family, and was 6 years old at the time of his abduction. On the back of Jacob's headstone are his 11 beliefs: to be kind, fair, understanding, honest, thankful, a good sport, joyful, generous, gentle, positive. Jacob was incredibly precocious in his wisdom. Just steps from Jacob's resting spot is a fresh gravesite at the time, without yet a formal headstone. Here lies my friend, Dr. Gretchen Butler. Gretchen graduated from St. John's Prep in 2003. She was a mother to 3 young children, a wife to a primary care PA named Mike, a sister to 3 other physicians, and the daughter of wonderful parents. She was top of her class throughout her training levels, including Teacher of the Year at Hennepin County in the radiology department, former Rocky Mountain Ski Patrol, and was passionate about women's health, rights, and racial justice. Essentially, Gretchen was world-class at fulfilling Jacob's 11 beliefs to others. Gretchen, however, struggled to share the same generosity and compassion with herself. Gretchen died by suicide on March 5th, 2021, at the age of 37 in her home, the dream home she and her husband Mike and 3 children had moved into just months prior. As we navigate the epidemic of burnout, moral injury, particularly amongst physicians and healthcare professionals, let this be a reminder for us to prioritize a few key principles of self-care, self-compassion. This is the best antidote to shame and its notorious sidekick, perfectionism. Brené Brown teaches us your level of belonging can never be greater than your level of self-acceptance, because believing that you're enough is what gives you the courage to be authentic, vulnerable, and imperfect. In order to impact and inspire others, we need to learn to lead, love, and trust ourselves. I challenge you to write down the most shameful narratives you tell yourself, to take off the armor, to toss this in the trash bin. It is all junk. I challenge you to love your imperfect self, to remember that you are good enough, and embrace the fully lived spectrum of the human experience. Boundaries. Clarifying what is expected while living with integrity, or saying, this is what I'm okay with, and this is what I'm not. Mike Butler, Gretchen's husband, told me that her award for being the top of her class throughout all training levels, becoming an excellent physician and leader, was, you're so good, here, take on more. I think many of you can relate to this. Consider the exercise of journaling on a person or reflecting on a person, either in your personal, professional life, or responsibility that is deserving of more boundaries, of more thoughtful commitment and interaction. Follow up on these to implement the necessary changes. Gratitude. Best medicine for hedonic adaptation, isolation, and depression. Let us consider living each day as if it were our first, with deep wonder and curiosity, as well as our last, with relentless gratitude. Start a daily gratitude journal, create a gratitude wall in your department workspace, mix in random acts of kindness, paying it forward in the many available ways there are each day. The impact on our happiness is much greater and long-lasting for those who give than receive. Curiosity. Viktor Frankl, a concentration camp survivor and psychologist who wrote one of my favorite books titled A Man's Search for Meaning, famously wrote, "Between stimulus and response, there is space. In that space is our power to choose our response. In our response lies our growth and our freedom." Think of a person you constantly find yourself judging or lacking curiosity for or about. What is driving that judgment? Where is it rooted? What would it mean for you in that space to assume they may be trying their best? To wonder with curiosity instead of judgment about their story and circumstances, and to perhaps inquire as such to them. To choose asking over telling. This will lead you through portals of expanded states of empathy, feeling with someone instead of for someone. Finally, meaningful relationships. Loneliness is one of the greatest predictors of mortality. Human connection is our most essential need. How many 4 a.m. friends do you have? People you would call at any hour of the day? How many people do you think would be willing to pick up the phone for you at that same time? I'm guessing the later number is greater than the former. What does that mean? Prioritize intentional and meaningful, undistracted time with those who you care about and share a mutual understanding of listening, of leaning into moments of uncomfortable spaces, but to also embracing joy, especially in nature, especially outside. Time is our most precious, renewable, non-renewable asset, and we should be considering it as something we should spend wisely. For the physician and healthcare professional community to transform from a state of surviving to thriving, it is imperative that we stand on solid ground upon the self-care principles outlined above, while also advocating for compassionate and sustainable healthcare systems. Finally, do you have a friend or relative who's a doctor, a nurse, a healthcare professional, leader? Take a minute now to text, to email them, to call them, and share your gratitude with them if you have not connected with them lately. Tell them how much they mean to you, and then remind yourself that you are enough. Graham and Nancy, Jacob and Gretchen would be proud. Thank you.